SRM Institute of Science and Technology. Learn, leap, and lead.
Yes. Good evening, everyone. Welcome to the Future Career Conversations webinar series presented by the Hindu and SRM Institute of Science and Technology. Today's session is on allied health and nursing, the backbone of modern healthcare. As healthcare systems continue to evolve, allied health and nursing professionals remain central to patient care, innovation, and healthcare delivery. Today's discussion will explore career opportunities, global demand, healthcare innovation, and the future of interdisciplinary healthcare education and practice. We have a distinguished panel of experts with us today. First off, Dr. Helen Shaji JC, Dean, SRM College of Nursing, Chennai. Mary Marjeri, Chief Nursing Officer, Naravi Hospitals, Vellore. Dr. D. Jagadeshwaran, Dean, Allied Health Sciences, SRM Medical College Hospital and Research Center, Chennai, and Dr. Rashmi Shukla, Senior Scientist, Division of Genetics, Department of Pediatrics, AIIMS, New Delhi. Thank you so much for joining us today. A warm welcome to all of our viewers as well. kindly drop your questions in the chat and we'll take them up towards the end of the session. So we shall now begin the webinar. I now invite our first speaker, Dr. Helen Shaji JC. Dr. Helen Shaji is a Dean of SRM College of Nursing and an experienced academician in nursing education and healthcare leadership. Her work focuses on nursing research, healthcare innovation, digital learning, and patient-centered care. She has actively contributed to conferences, mentorship, and interdisciplinary healthcare education. She will be speaking on the evolving role of nursing professionals and the rising demand in India and abroad. Over to you, ma'am.
Thank you, Meenakshi, for your introduction. Hope my slide is visible.
Yes, ma'am.
So I will just talk about, as you all know, that nursing and allied health are the backbone of modern healthcare. As you all know, nurse is the heart of the healthcare system, and healthcare is a system where nurse is the one who connects the system. She connects the doctors, patients, families, and technology. So as a nurse, she should be knowledgeable enough to drive all these forces in the hospital. So we will just move on with the topic about rising demands of nurses in India and globe. So in India, if you see, there is an increasing burden of chronic diseases. This is happening across the globe too, but chronic diseases are increasing, aging population is increasing, and the hospital infrastructures are getting expanded, where we need nurses to serve for these population. And the growth of tertiary care hospital. There are more and more tertiary care hospitals are coming up. Many medical colleges are started to cater the needs of the healthcare demands of the people. And the home healthcare, this is the very recent trend, which is also growing, where we need nurses to serve. And the rehabilitation centers are increasing, and telehealth services are also increasing. These are all giving a widened opportunity or employment opportunities for the nurses in India. And the government initiatives such as Ayushman Bharat and the expansion of medical colleges are also increasing the health workforce requirement. And if you see the special areas, the geriatric care, as I told you, that aging population is increasing. So when aging population is increasing, there we need more number of nurses to serve, because the physiology of elderly people are different, and people should really know how to give holistic care to the geriatric population. So the people, the nurses with specialty courses like geriatric care or palliative care, their employment opportunities are also increasing. Palliative care oncology nurse, then infection control nurse, and critical care and community area also, the community health nurse or public health nurse. These are the demands in India. If you see across the globe, the global demand, if you see, none of the nurses who are trained there in India is staying here. They keep moving to different countries, not only to the Western countries, they even move to the Gulf countries also. The countries like UK, Canada, Australia, Germany, New Zealand, and Gulf nations continue to recruit Indian nurses and allied health professionals due to workforce shortage. And even if you see the work pattern and culture of those people in Western countries, very few people come forward to serve there in the healthcare system. So they always want to maintain a work-life balance, and which is very much the Indian nurses are welcomed for their purpose. Next to Indian nurse, the Filipino nurses are called for all these kind of healthcare services. That is why the demand is very huge across the world. International demand is increasing again because of the aging population. Aging population is there because of due to technological advancements, and where there is a shortage of trained healthcare workers. Unlike India, overseas, when we see, they are not only having hospitals, they have hospice centers, daycare centers, and home healthcare services. These are all the areas broadly opened there in abroad. They have tertiary care centers. So there, the tertiary care centers or the peripheral care centers completely run by the nurse practitioners. So the demand for nurses are increased across the globe. And when the nurses with specialty certifications, for example, wound care nurse or palliative care, geriatric care, or colostomy care nurse, such kind of certifications are there, again it adds value to their employment. Then nurses with language proficiency. If they really want to serve there in US, UK, New Zealand, and Canada, of course, they have to clear their OET exam and IELTS exam. So that this language proficiency is important. Of course, in India, all the nurses are proficient. Most of the nurses are proficient in English, and the curriculum is taught in English only. So they will develop their reading, writing, speaking, and listening skills during their program itself. So the nurses with language proficiency, not only English, if you want to serve there in German countries, the nurses who knows German language and certified with the German language proficiency are easily getting recruited. The opportunities are more there in German. Nurses who are certified with Japanese language, they are welcomed by Japan. And those nurses who are with international licensure have better opportunities. International licensure in the sense, every country will have its own licensure exam. In US, if you see, or Canada, they have to clear NCLEX exam. Similarly, in Australia, APRA exam is there. If you see the Gulf countries, they have their own licensure exam. Dubai DHA exam is there. So if they clear or if they have international license, their scope is very high in other countries. Mobility of healthcare professional is increasing through global partnership and academic collaborations. I just would like to give a glimpse about the technology. When more and more demand is there for the nurses, it is a need of the hour for all the nurses to update their skills in technology. Technology is growing up everywhere. If you see there in the hospital, the intrusion of AI is there, artificial intelligence is there. I would say that artificial intelligence is a boon to the healthcare system if you use wisely and in a very productive way. So AI-assisted monitoring systems are there, which is helping for the early detection of patient deterioration. So nowadays you are seeing wearable sensors are there, and the wearable sensors are able to predict the pattern of the patient's disease, or it is signaling them, or it is giving alert to them when their condition gets deteriorates. So predictive analytics supports clinical decision making and reduces medical error. And AI-based documentation is also coming up there in the hospitals, and it is reducing the human workload, and we will be able to cater the needs of more number of people. And electronic health records are also improving the efficiency. Coming to robotics and automation, this is also another technological advancements there in case of surgeries. Mainly the robotic assisted surgeries. All the corporate hospitals have started doing robotic assisted surgeries, especially when you go for a long hours surgery. This is of really great use, and it improves precision and patient recovery outcomes. The shorter hospital stay and the recovery outcomes is good. You can see the picture here. This is the picture of robotic assisted surgery. So the surgeons are trained with this robotic surgeries, and they try to do those kind of things in all the hospitals nowadays. Then automated medication dispensing. So we need not to be a nurse to be there and dispense the medicine, or take the medicine to be a pharmacist to be available. All those things have gone now. Started implementing all this automated medication dispensing. It is gradually coming up in India also in some of the corporate hospitals. So very soon in every hospitals will have this automated medication dispensing system. By using the QR code of the patients, it will be done, automated. Then smart ICUs also, that is also reducing workload and enhance the patient safety. Smart ICU can function when the patients are connected with the sensors, monitors, and everything. So only thing, the nurse should have a digital literacy and she should have a technical knowledge to handle those things. Then rehabilitation robotics are coming up, and it is really a boon for the patient. The physiotherapist need not to spend much time with the patient to do all these kind of motor abilities and other things. So rehabilitation robotics also assist patients in recovery and mobility training. And telehealth is also coming up because the telemedicine, the consultation during the COVID time, we started learning even how to do consultation through these telehealth services. So expansion of telemedicine enables healthcare access in even rural and undeserved areas. The Ayushman Bharat, the goal is mainly to provide accessible and equitable care to all the people living both in rural and urban. So for the even the undeserved people, this health will reach. Then wearable devices and remote monitoring allow continuous patient assessment. This continuous patient assessment will provide a real-time data which helps for the doctor to go for an advanced decision making and so on. Wearable devices are playing a major role therein during pregnancy. During COVID time, the pregnancy belts was introduced and the fetal heart rate and the false contractions were able to be identified in a remote way, and the obstetricians were able to take a decision accordingly. So such kind of advanced wearable devices are also coming up nowadays to reduce the workload of the human and with the accuracy and everything. So nurses play a key role in virtual care coordination and digital patient education. This is also another boon because every time you can't give education to the patient face to face. Once during discharge, when you give some education, that has to be followed up during their stay at home for a period of 2 to 3 weeks after discharge. So that can be done through this digital platforms. Even using some QR code, more number of information and health education can be given to the patients. So when we start using technology, we will have to know about the challenges also for adopting the technology. What are the challenges we face? Need for training in digital competencies. So we will have to train the nurses, keep on training the nurses for digital competencies and ethical use of AI. That is very important. Then concerns regarding data privacy. Of course, everything is being shared. Patient's information is shared. Then there is a privacy concern, patient confidentiality, and sometimes we say that we are over depending on technology. So one thing we all have to keep in mind is technology should complement compassionate care, not replace the human connection. No technology can replace the human touch at all. So I would say that the nurse, in the public, the people are saying that AI is going to replace all the healthcare workers very soon. It is not going to happen, but the nurse who really knows how to use the artificial intelligence technology in her day-to-day work will survive forever. So let us just discuss about what are the specializations in nursing. What are the specializations? So when a basic BSc nursing degree, once the student completes the 4 years graduate degree program, after that, there are lots of specializations available. Even across the globe, if they wanted to take a job, it is better to go for higher education and the specializations. When you are specialized in particular area, you will be absorbed in that area to work where your perks and other privileges are given in a different way. So critical care nursing, those who are specialized in critical care area, they are able to serve in ICU kind of setup, emergency and trauma areas. And those who are specialized in medical and surgical nursing, they can work in all the medical wards, ICUs, as well as they can work in all the surgical wards. Then obstetric and gynecological nursing, this focus mainly for taking care of mothers during pregnancy, as well as all the gynecological disorders during delivery and so on. Pediatric nursing, they are mainly concentrating about the children, child's health, as well as the neonatal health. And there is again super specialties are there, neonatology, etc. Then there is a important field where we give more importance for the mental health of the patients. So the psychiatric hospitals are having huge demand for this psychiatric nurse, which is also one of the important specialty. And in the medical surgical itself, people go for specialty nursing like subspecialty as oncology nursing, where they are working in the patients with cancer and palliative care centers, etc. Cardiac nursing, those who are specialized with cardiac nursing will work in the intensive cardiac care unit and critical care units. They also can work in all the interventional cardiology diagnostic procedures. Then nephrology nursing, those who are specialized in renal and related things will work in the nephrology area. They will be skilled in doing hemodialysis and hemodialysis, taking care of patients with hemodialysis, peritoneal dialysis, and taking care of patients with chronic renal disease and the end-stage renal disease. Geriatric nursing, as I told you already, that geriatric nursing is mainly to take care of the patients during elderly clients. And operation theatre and perioperative nursing, these the nurses who are trained with operation theatre techniques, they will be all the times working there, most of the time there in the operation theatre. They knows about all the scrap techniques and all the procedures which are happening there in the hospital. And perioperative, they will be very skilled in preparing the patients for surgery, and during the surgery, how to assist and how to do the scrubbing role and circulatory nurse role inside the theatre, as well as after surgery in the immediate post-anesthetic care unit, how to take care of the patients until discharge. They will be skilled in that. It is not that the other nurses are not skilled in all these areas. The basic BSc nursing curriculum itself is preparing the nurses to work in all the areas, all the specialty and super specialty areas. But if the institution asks for any specialty course, you can also opt for all those things. And public health nursing or community health nursing, this is the specialty area where the nurse will work there in the community side as a PH and primary health nurse or the community health nurse, where they can cater the needs of the rural population. So what are the emerging and future specializations? In the previous slide, what I discussed is the specialty is already available and people are doing also. And there are some of the specialties which are emerging and which some may come in future. So technology-driven nursing roles. So the present nurses have to think about these kind of opportunities are also going to open in future. Telehealth nurse, then AI-assisted clinical nurse, then nursing informatics specialist, then digital health coordinator. Because the technology is growing up, all the machines are there, even in the ICU setup, the high fidelity machines, ventilators are there, and you have all the infusion pumps and advanced machineries. They should know how to handle it and how to integrate with the AI. Then advanced practice nursing. In advanced practice also, nurse practitioner courses already there. Even it is available in institutions like SRM. Then nurse anesthetist. So they will be really specialized in anesthesia and other things. Nurse midwife. This in globally, we say that after completing BSc nursing program, they will go for obstetric and gynecologic nursing in PG degree program. They are only considered as nurse midwife. But our Indian curriculum is preparing in the UG degree itself to serve as a registered nurse and registered midwife. Then we have clinical nurse specialist, then nurse advocate, those who are really learning all these law-related things, forensic or medicine, they will be really skilled in those things. Then research and innovation. This is a really going to be a new field, or it is an ongoing emerging field for the nurses. We are concentrating more on research also. Bedside is the first clinical lab where you will start your research. So research will not start in any of the very big research laboratory. For the nurses to do research, it will start at the bedside of the patient. Only thing you will have to identify what is the optimum care and what is the current care practices, how it can be converted into optimum care, what are the gaps there in the practice. Through that, the research will start. So evidence-based practice specialists, then clinical trial coordinators. In many laboratories, pharmacological laboratories, as well as in the research institutes, medical college and research institutes, these posts are available. Clinical trial coordinator, then healthcare data analyst. There are other specializations also, which is very commonly asked there in overseas. Wound care specialist. That means the nurse who has a basic degree in nursing and who specialized in that particular wound care, they will be given, they will be allotted for taking care of patients with different diabetic wound and gangrene and so on. Then palliative care nurse, then colostomy care. This is mainly for the patients undergone colostomy. With bowel cancer patients, they normally go for a temporary colostomy and permanent colostomy. So how to take care of their colostomy throughout their life and what kind of dietary instructions need to be followed, everything, she will be well versed in that. There is a niche area called transgender care nurse. So this is the neglected area, I feel, that in all the healthcare system. But we are preparing our students for this transgender care also. Transgender inclusive healthcare. Their needs are different. Their mental health needs are different. So they have to know, even gender reassignment surgeries are coming up. So they should know how to take care of the transgender people for the hormonal therapy and gender reassignment surgeries, and taking care of the taking care of their mental health. By the end, I would say how to take care of them in a holistic way. With this, I just conclude my talk. Thank you.
Thank you so much, ma'am, for those valuable insights. I think you've covered a range of important topics. So we'll move on to the next speaker. I invite Mary Marjeri. Mary Marjeri is a Chief Nursing Officer at Narvi Hospitals, Vellore, with extensive experience in nursing leadership, healthcare quality, patient safety, and accreditation processes across India and Saudi Arabia. She has led major nursing excellence initiatives, including magnet recognition and Joint Commission international accreditation programs. Her expertise includes quality improvement, patient safety, nursing excellence, and healthcare transformation. So, today she will be sharing insights on the existing skill gaps and training challenges with respect to nursing. So, over to you, ma'am.
Good afternoon, respected panel members and all participants, pan-India participants who's attending this webinar. And before I begin, I would like to thank SRM Institute of Science and Technology and the Hindu for organizing such a wonderful webinar, and Naravi Hospital who gave this opportunity to participate in this webinar too. And to all my nursing colleagues, wishing you all a happy Nurses Day coming up tomorrow. Our nurses are future. Empowered nurses saves lives. With this keynote, I would like to start my presentation on allied health nursing, the backbone of modern health. The nursing, Florence Nightingale has defined nursing a long time ago, saying that it is the act of utilizing an environment of the patient to assist him in recovery. She believed that primary role of nursing was to manage external conditions such as clean air, light, warmth, cleanliness, and quiet, and most best possible condition for nature to act. Whereas the definition has been reformed to say nursing is a highly skilled, science-based, and patient-centered profession that focuses on holistic care, disease prevention, and health promotion. So, does it justify nursing is a backbone of healthcare? Definitely yes. because if you look at the current status and the statistics of nursing members, the workforce size approximately is 3.3 million nurses are available in India. That represents 8% of the global workforce. And the composition includes 2.34 million registered nurses and 0.94 million of auxiliary nurse midwives. And nursing growth sets steady increase by 40% since 2014 to 2015. And of course, the females have majority of 80% of the nursing in the workforce and 20% of the male gender. And nurses are widely considered the backbone, and ma'am rightly said nurses are called as the heart of the hospital. Yes, of course, they are the one of the unsung heroes in the healthcare. And nurses, they run the show of the hospital, because when the doctors comes, finishes the rounds and sets the action plans and sets the treatment plan, while the doctors are recognized for the critical expertise, but the nurses are more frequently identified as a foundational backbone that keeps the system stable, who communicates, who collaborates, who interacts with other interprofessional team members, and most importantly, 24/7, nursing is the frontline people who communicates to the patients and the caregivers and to the family members. So definitely nurses are the backbone of the healthcare and the heart of the organization. So the key skill, I will be talking in depth about the key nursing skill gaps. The nursing students, when they finish and they get into the work environment, there's definitely a skill gap because they are facing the real life challenges. Of course, they would have met the patients, they would have uh, taken care of the patients, but when they face the real life challenge, when they take as a staff nurse role or a registered nurse role, definitely there is a gap between the education and clinical expectations, is a widening leading to the patient safety concern. In terms of technical and clinical skills, ma'am has rightly spoken about lot of technology, robotics, and smart ICUs, which the students may or may not have seen in their training period. Some institutes have the opportunity to see, but some don't have. So when these students get into the organization as a registered nurse, when they practice as a registered nurse, definitely they do have a challenges in coping up with the skills. And it is not only the nursing students when they transition to the program having the problem, but definitely the other nurses when they move on to the high technology hospitals, yes, they do have challenges in adopting to the technical and clinical skills. And the limited hands-on experience in specialized procedures and new technology management has definitely has a gap, which has to be taken care in their orientation programs. Critical thinking and delegations. The newly graduated nurses often struggle with quick decision making and delegating the task effectively. And soft skills and communication, shortages in empathy, emotional intelligence, and confident communication with doctors and families are being reported. Documentation and time management, inefficiency in managing heavy workloads and keeping pace with electronic chatting. It is definitely a challenge which we are witnessing because students or the new registered nurses may not be competent in writing in the electronic medical documentations. And all hospitals may not have electronic medical documentation. So it is a real skill gap which has to be filled up during the transition program. So the concept of adopting a transition to practice program, not all healthcare organizations has got. So moving forward, the healthcare organizations has to adopt a transition to practice program. Post-COVID, if you have noticed, US and UK have recruited people who just finished the nursing. Why? Because they have a well-structured practice to transition program. This practice to transition program can run at least minimum of 6 months, maximum of a year. 6 months is a well-to-do program which supports and mentors the the upcoming new nurses, which provides the preceptors, mentors, and ongoing support to reduce the stress during the first year of practice. Definitely, they need this one. Clinical and professional focus combines hands-on clinical training with professional development, focusing on critical thinking, patient safety, and communications. We are well versed in the preceptorship program. Beyond the preceptorship is a mentorship program where they can provide a long coaching and they can take them as a role model and they develop a long-term skills when we have a mentors. Bridging the gap. focusing on evolving from a student mindset to an independent practitioner responsible for a complex patient care is very, very essential. So, the identifying the skill of each individual may vary from person to person. So, individual identification of the skill gap and topping up and reducing the gap definitely puts the people with a good confidence and promotes the patient safety to prevent medical errors. As the elder generation or the senior generation is going to take over or going to have a smooth transition, the younger generation definitely need a succession plan, which is a highlight or which is an area for focus in the current healthcare, definitely in the nursing profession, I would say, because we don't have a talent development adequately in the current nursing professions. So we need to have a talent development, identifying the people who can have that particular roles, the skills whom they have. So we can identify the gems among them, and we can train them, we can polish them, and we can keep them with the talents ready and the skill checklist completed, so that they can take a leadership development role without any struggle, or with the smooth transition can happen. If you don't have a proper succession plan modeling in the healthcare setup, that can lead to the gap in the patient safety outcomes or in the patient outcomes. There'll be definitely a gap can happen when a senior leader moves the organizations. So the succession plan has to be considered as one of the vital in the healthcare settings. So the leadership development can be developed, and then the pooling system of pipeline, which includes when there is a vacancy, these people can be moved immediately. So those kind of systems can enrich the nursing work environment and develops the transparent communications, and puts people who can take the next role immediately, or in absence of this particular person, who takes the role of this without any gaps or without any challenges in setting up the patient outcome. So the succession decisions considers a diverse pool of candidates, not only the direct reports, but it is a board engagement. So the leadership can be involved. Who can be identified for this upcoming positions can be taken over by whom, and what skills are required, and what training programs is required for this particular person. So we can develop a good succession planning so that the healthcare system flows without any turbulence. Of course, the mentorship program has to be run for the new as well as the senior leadership program. So they inspire from the other people, they learn, and the world is looking for a succession planning and the mentorship program, because when the senior people leaves, when the Gen X and the current generation is going to take over, the empathy and the trends and the empathy and the leadership qualities what the senior roles have taken such long has to be passed over to the next generation. That is one of the major empathy transformation has to happen between the generation to generation. And I would strongly recommend that succession planning and mentorship programs has to be incorporated in the current nursing curriculums, as well as as ma'am mentioned, the technology has to be incorporated in the current curriculums. And I would add on to what ma'am said, the quality development, patient safety and quality development is one of the trend setting carriers which we are having in the current healthcare settings. So that can be added on to the current nursing curriculum, quality improvement, patient safety, and the computer basic computers, how the documentations can be done. And the use of course, we have the fundamentals of nursing where we have basic procedures like bed making and all as being taught in the classroom setups, whereas we can include the infusion pumps so the people, the students and the nurses can have a hands-on skill with this kind of smart devices so they don't struggle. And the empathy, most important, it has to be carried on to the generation to generations, so that the nurses at this generation carry on that empathy. As ma'am rightly said, we may have technology, we may have AI integration programs, but the empathy cannot replace. The human touch cannot replace. That's where the nurse stands as a backbone of the modern healthcare system. So the touch of the nurse heals the patient. The smile of the nurse heals the patient. The nurse who stays with the first breath and the last breath cannot be replaced by the technology. And with this good note, I would like to say thank you for this opportunity one more time.
So much, ma'am, for those very, very insightful perspectives. Our next speaker is Dr. D. Jagadeshwaran. Dr. Jagadeshwaran is the Dean of Allied Health Sciences at SRM Medical College Hospital and Research Center and has over 23 years of experience in allied healthcare education, research, and administration. He also serves as president of the Professional Council under the National Commission for Allied and Healthcare Professions, Ministry of Health and Family Welfare. His work focuses on strengthening academic quality, professional standards, clinical training, and innovation in allied health sciences. So today he will be speaking on the expanding scope of allied health professions and opportunities in the healthcare ecosystem, both in India and abroad. Over to you, sir.
Thank you, madam, for your kind words of introduction. Hope my screen is visible.
Yes, sir. Yeah.
Thank you. Good evening to the panelists and to all the participants. It is a great privilege to address all of you today on the topic allied health and nursing, the backbone of modern healthcare. Today, I'll briefly discuss about the importance of allied and healthcare profession, the growing demand of AHP profession in India and in abroad, the government of India's initiatives, existing skill gaps, training challenges, and future-ready solutions. So let us begin to understand who are the allied and healthcare professionals and why are they so important. If we look at the definition of allied and healthcare professionals, they are the competent professionals who deliver diagnostic, therapeutic, rehabilitative, curative, and preventive healthcare services in collaboration with doctors, nurses, and other healthcare teams. Their responsibility primarily include patient diagnosis and monitoring, rehabilitation and recovery, preventive and community healthcare, technology-driven healthcare services, and ensuring quality patient care management. These professionals form the operational backbone of the healthcare system. Whether it is a medical laboratory professional who is providing an accurate report or an emergency medical technologist saving lives during a critical condition, every role is quite essential. And the future of the healthcare depend on collaborative, compassionate, and competent care, which I think our previous panel is also emphasizing. And it is also one of the quality requirement for allied and healthcare professionals to achieving their vision. Modern healthcare actually has evolved from the doctor-centric model to a multidisciplinary healthcare model, wherein today healthcare delivery depends on coordinated teamwork along with the doctors. It includes nursing professionals, laboratory experts, dialysis therapists, imaging specialists, nutritionists, so on and so forth. This collaborative model improves the patient safety, improves the clinical outcome, enhances the quality of care, and overall healthcare efficiency. In reality, every life saved, the entire team, especially in the multidisciplinary team, work together to ensure that to render patient safety and improve the quality of life of the patients. Therefore, allied health science professionals and nursing are no longer play a supporting role. They are the fundamental pillars of modern healthcare system worldwide. So this is the transient change happening within the healthcare system. Moving on to the specialization of the allied and healthcare profession. I think the government, thanks to the initiative of Government of India, it has brought a landmark reform or National Commission for Allied and Healthcare Profession Act, which was passed in the Parliament in the year 2021, and the National Commission came into existence in the year 2024. Under the National Commission framework, there are 10 professional councils which have established, which has 57 allied and healthcare profession under its ambit. So I think due to time constraint, I will not be going into all the professions, just will be highlighting a few professions from each of these 10 professional councils. To start with the medical laboratory science and life sciences, the first professional council, the medical laboratory professional. Then we have life science professional, which includes the medical genesis. Then we have forensic science technologists, so on and so forth. And within the next council, it is the trauma, burn care, and surgical, and anesthesia. As the name denotes, it includes anesthesia and operation theater technology, then emergency medical care technology, advanced care paramedic. Physiotherapy professional is widely well known. Then we move on to the nutrition science, where the nutritionists and dietitians also included in the SAID council. And within the ophthalmic sciences, optometrists, vision science professional, and ophthalmic assistants were included in the SAID council. And occupational therapists. And this seventh is the community care, behavioral health, and other professionals, which is again it's includes psychologists other than the clinical psychology, which includes school psychology, sports psychology, forensic psychology, so on and so forth. And also within this group, we have podiatrists, social workers, psychiatric social worker, medical social worker, ecologists, environmental health professional, diabetic educator, palliative care medicine, and last but not least, the acupuncturist. And in the 8th professional council, we have the medical radiology imaging technology, wherein the medical radiology and imaging professional, radiation therapy professional, nuclear medicine professional, and medical physicist. And the 9th is the medical technology and physician associate biomedical, which again has a wide array of professions, which includes physician associates, cardiovascular technologists, dialysis therapists, urology technology, neuroelectrophysiologists, biomedical engineers, etc. And last is the health information management and health informatics. Actually, this is another rich area where the health information profession, so-called the earlier medical records, now have been transformed into health information management. And it also includes medical coders and medical transcription. So each discipline contributes uniquely towards building a stronger healthcare system. At the institution like SRM Institute of Science and Technology, in addition to the programs which I have mentioned, a significant emphasis also being placed on advanced and future-oriented allied and healthcare program, and some of the important areas like audiology, speech language pathology, clinical psychology, which are all being regulated by the Rehabilitation Council of India. It's also very unique programs offered. And sports and exercise psychology, critical care technology, hospital administration, and clinical research. Such programs are also essential to develop high-skilled professionals who can adapt to evolving healthcare system and emerging patient needs. Moving on to the growing demands of allied and healthcare professionals in India and global and outside India. This slide primarily highlights the rapid growing demands for allied and healthcare profession, both within the country and outside India. Especially in India, the healthcare sector is expanding at an unprecedented pace due to the growth of hospitals, diagnostic center, multi-specialty healthcare institution, and digital healthcare system. At the same time, the increasing burden of non-communicable disease such as diabetes, cancer, cardiac disease, kidney disease are creating a greater need of skilled healthcare profession. There is also a rising demand for critical care, emergency services, rehabilitation, and most importantly, geriatric care, diagnostics, telemedicine, and technology-enabled care. And importantly, healthcare services are now expanding beyond metropolitan cities. Now it's moving into the Tier 2 and Tier 3 cities, creating large employment opportunities across the country. Globally as well, healthcare system facing shortage of trained allied and healthcare professionals, especially as Madam, the previous panelist has highlighted, the aging population, rising chronic disease, advanced healthcare technology, and patient-centered care models are driving this demand worldwide. Indian allied and healthcare professionals are highly valued internationally because they have a strong clinical exposure, adaptability, good communication skills, and experience in high patient load healthcare setting. With international certification pathways and globally aligned education, Indian professionals now have opportunity to work and to contribute in healthcare system across the board. Overall, this growing demand not only creates meaningful career and global mobility of students, but also strengthen both the healthcare system and improve the patient outcome both within the country and outside the country. Recognizing the critical importance of allied and healthcare professionals, the Government of India has taken a landmark step in the recent Union Budget 2026. An allocation of ₹1,000 crores has been announced for scaling up allied and healthcare professionals in our country. Additionally, the Government of India aims to add 1 lakh allied and healthcare professionals over the next 5 years. This initiative will build a future-ready healthcare workforce, improve access to the affordable healthcare, strengthen healthcare delivery across both in the rural and urban areas, create a large scale of employment opportunity for the allied and healthcare professionals within the country, and support India's vision of universal health coverage. This decision is actually reflects the national recognition for the allied and healthcare professionals as an indispensable workforce to the future of healthcare. It is a major investment in human capital, healthcare quality, and national development. Thanks to the initiative of the Government of India. And the Government of India has also, at the first phase, has identified the following priority discipline for scaling up the training capacity. These are the following professions were identified at the first phase. The optometry, physiotherapy, medical laboratory science, dialysis therapy, radiology and imaging technology, anesthesia and OT technology, emergency medical technology, occupational therapy, applied psychology, behavioral health, and palliative care. These disciplines are extremely important because they are directly address the current healthcare challenges such as rising chronic diseases like CKD, CHD, etc. Mental health needs, emergency care demand, cancer management, and most importantly, the elderly patient support. In spite of having a growing opportunity, still there are some important skill gaps that need an immediate attention. Some of the key challenge includes a gap between theoretical knowledge and a clinical competency, limited hands-on exposure, and low readiness of AI, digital health, and health informatics, limited exposure to research and evidence-based practice, deficit in leadership skills, teamwork and communication skills, and global employability gaps related to documentation and international healthcare standards. Primarily, this was due to the change, the difference in the curriculum observed across the country from Kashmir to Kanyakumari. There is no uniform curriculum, and that has put us a lot of challenges. And this gap can have an effect on the patient safety, clinical confidence of the professional, and adaptability to modern healthcare system. Therefore, strengthening the healthcare education is equally important as expanding the healthcare infrastructure. So as I come to the final part of the presentation, and as I told earlier, one of the major challenge pertaining to the training requirement is the non-uniform curriculum implementation and limited structure internship and mentorship, rapid technological advancement creating gaps between academics and the industry expectation, insufficient hospital academic integration, and evolving competency-based evaluation methods. To address these needs and challenges, the National Commission for Allied and Healthcare Profession has introduced several future-focused initiatives. And to highlight one, that is the One Nation, One Curriculum concept and the competency-based curriculum to ensure standardized outcome-driven education across India. Under the One Nation, One Curriculum, so far 17 curriculum has been released by the National Commission covering 28 professions, and the remaining curriculum will be released in a due course of time. There is also strong emphasis on the clinical and simulation-based training, integration of AI and digital health technologies in the curriculum. Structured internship has been included in the training system. Leadership and ethics training, faculty upskilling and reskilling is also made essential, and stronger collaboration between industry, hospital, and academia has also been emphasized. Together, these initiatives aim to create allied and healthcare professionals. This will create a competent, compassionate, tech-savvy, collaborative, ethical, and globally competent professional. And ultimately, our goal is to build a skilled, resilient, future-ready allied healthcare workforce to cater the need of both our country and also outside the country. So thanks for the opportunity and thanks for listening. Thank you.
Thank you so much, sir, for setting the context with respect to allied health. We now move on to our next and final speaker, Dr. Rashmi Shukla. Dr. Shukla is a senior scientist, Division of Genetics, Department of Pediatrics at AIIMS, New Delhi. Her work focuses on genetics, pediatric healthcare, and translational medical research with significant contributions to interdisciplinary healthcare and evidence-based research. So today she will be speaking on the role of technology in patient care, specifically robotics and AI, as well as work conditions and policy support for those in the allied health sector. So over to you, ma'am.
So good evening, everybody, and thank you very much, Meenakshi, for that kind introduction. And at the outset, I think I would like to thank the SRM Institute of Science and Technology and the Hindu group for having me over. And what I probably bring on, in addition to what Dr. Jagdishwaran so beautifully highlighted, is going to be the policy perspective from NCHP. I represent a government institution, and I also represent, I hope my slides are visible.
Yes, ma'am, they are.
So, and I also play a key role in the National Commission for Allied and Healthcare Professions, as Dr. Jagdishwaran was elaborating. So I will try to highlight how NCHP is perhaps an initiative which has come into force since 2021, and what NCHP is doing to strengthen the allied healthcare professions in India. I will be talking about how AI is transforming healthcare in India. And what I feel is that AI today is one aspect which none of us can really escape. And as Helen ma'am also had elaborated in her presentation, that AI is a empowering tool, and it empowers not just doctors and nurses, but it equally empowers the allied healthcare workforce by enhancing diagnosis, optimizing personalized care, predicting outcomes better, and overall improving access to care while ensuring privacy and security. So AI, as ma'am also pointed out, is not here to replace any one of us, but it is rather here to help us improve and to empower us. So this vision has been integrated into the NCHP mandate as well. And what NCHP has done is that it has tried to integrate concepts of artificial intelligence and technology into all the new curricula that are being developed, as Dr. Jagdishwaran pointed out, part of the One Nation, One Curriculum goal. And ideally, what we are trying to achieve here is that without replacing the core professional, we are trying to ease the fatigue by handing over repetitive workload to AI. So even I represent life science and laboratory sciences. So a lot of mundane activities like pipetting, collection of, or rather liquid handling, most of it is can sometimes get quite repetitive, boring, and mundane. So what most of us have noticed over the last couple of years is integration of these robotic tools, the digital tools, as well as AI tools to ease our workflow. So I think one of the first integrations that had happened in the laboratory setup was the robotics for liquid handling. And of course, we are aided by a lot of softwares which help us in doing genomics and precision medicine, particularly when we are handling a bulk of whole genome and whole exome data. Imagine 3 billion base pairs to read is impossible to be done without AI help. So as I think everybody in the panel had pointed out, AI is not replacing the professional, but it is aiding us to improve in the work that we deliver and improve our efficiency. I really love this quote, and I thought I should share it with my audience today, that AI is perhaps the most transformational technology, and healthcare is perhaps AI's most pressing application. Can't be more true. And if you see across all the allied healthcare professions, perhaps none is left untouched by AI. And it is the onus is on us to ensure that our future students and our future workforce is well equipped with using these AI powered tools in a smart manner to deliver better care and ensure that we emerge as empowered professionals, and together we create healthier communities. And NCHP has done its bit in trying to ensure that uh, AI or technology is part of the new curricula which are being developed at NCHP. And one of the mandates for the new curricula standardization has been to ensure that technology-driven education is included in all curricula which are being released and will be done in the future as well. The goal here is that we should be able to create a workforce which is future ready and is able to handle lab diagnosis and healthcare with better accuracy. And also, we learn to integrate the various needs across professional boundaries. And all this is possible if we understand each other's needs. So AI is not going to impact just diagnostics, but also treatment planning, rehabilitation, accessibility to information and improved care. And of course, as Helen ma'am was pointing out, patient safety is at most important here. So uh, AI definitely ensures that there are reduced errors and we deliver precision diagnostics and precision care to our patients. NCHP, as Dr. Jagdeshwaran also pointed out, is a wonderful initiative of the Government of India, although it came pretty late in India's modern history, so to say, one of the newest councils to be formed. We are very young, but I think I'm proud to say that in the last 2 years or so, we have, done a lot of work in terms of standardization of curricula, the regulations, the central repository in association with the state councils. And the biggest impetus that NCHP has provided is perhaps in terms of the One Nation, One Curriculum mandate. And it's all work in progress currently, and we are trying our level best to ensure that all the gaps that we see across us in the so as Dr. Jagdeshwaran pointed out, there are 57 professions which have been taken under the umbrella of NCHP. So it's a humongous task for all of us. However, the task cut out for us is not just the standardization of curriculum, but it is also for us to ensure that there is a mandatory registration, something which was never heard of in the allied healthcare sector. And the whole idea behind mandatory registration and licensure process is to ensure that only qualified and registered practitioners are able to deliver healthcare in their respective specialities and their respective professions. And of course, the One Nation, One Curriculum mandate we've initiated this year, and I hope uh, the uh, these steps continue in the future and we ensure that all the 57 professions which get covered by NCHP have their own standardized curriculum which the entire country will follow, and ensure that each professional emerging from these educational institute gets the exact same quality and standard of training and education that we expect from each one of them. One of the major initiatives that NCHP has taken is the profession recognition and definition. So for the first time, I think in the history of allied healthcare professions, now each profession has its own nomenclature, which is being defined by their qualifications, what going forward would be acceptable, and how we wish to, integrate professional qualifications from the past. And along with these steps, we wish to ensure that across the nation, all institutions and healthcare structures which are under the mandate of NCHP are standardized to a certain level that they all offer the same structure, the same infrastructure, faculty, labs, equipment, and training standards to ensure that there is a better learning environment and an equitable learning environment, whether a student trains in Delhi or in Tamil Nadu, they get exactly the same level of education. And of course, we are quite cognizant of the fact that up until now, there was no clear-cut policy to support career development. So NCHP has taken upon itself to also, we are already in the process of defining the scope of practice and other regulations, which once formalized will ensure that the gray areas which demarcate each of the professions are no longer there, and there is clear professional definition as well as professional boundaries within which each individual will have the right to practice. And of course, I mean, there are certain professions where independent practice was always a possibility, but was somehow mistaken upon, and NCHP will ensure that wherever and whichever area it is possible, the scope for independence practice continues. And the whole idea of developing the scope for practice document or regulation by NCHP would to ensure that there are defined career progression pathways. There are fair systems for recruitment, equal employment opportunities for individuals who are equally trained. And of course, there are standardized structures for salary and improved motivation for retention of workforce. So for this, NCHP is working very closely with all the state and state allied health councils. And I'm really proud to say that in the last 2.5 years, pretty much 80% of states and union territories across the nation have established state councils, and health and education being state subjects, the role of state councils cannot be undermined. So it will be upon the state allied health councils to maintain the registers for practitioners, to ensure that institutions offering various programs comply with the standards that NCHP puts forth, and the code of ethics and professional conduct is followed to the T. So as I said, this is all work in progress because we are a very, very new commission, and we are in the process of developing most of the regulations that are required to efficiently run our commission and run the allied health professions. And over the next couple of years, we hope that all the different programs have a standardized education format in terms of a uniform curriculum. The registration and licensing process will begin very, very shortly. The professional conduct and ethics document has already been, is already live. So hopefully that will become a law pretty soon. And upcoming are also the regulations for infrastructure of institutions, the faculty and staffing requirements in alignment with the proposed curriculum. And all this is being done to ensure that there is an international recognition of all the allied healthcare professions who graduate from our system going forward. And as Dr. Jagdeshwaran pointed out, Helen ma'am pointed out, there is a huge need for allied healthcare professionals, not just in India, but across the globe. And what was perhaps being a deterrent so far was lack of standardized curriculum. So it was very difficult to establish equivalency of the program that a student had undertaken. And also because we lacked a licensure system or a regulation that gave us a registration as a professional, global mobility was considerably a challenging issue for many students. Going forward, however, we hope that not just within the country we will have a more uniform and improved ecosystem for allied healthcare professionals, but we would also have uh, uh, we will also ensure that there is the scope for international mobility amongst all the professionals. So for this, what NCHP has done, we recognize that career pathways can be diverse, starting from entry level right up till the administration and management level and beyond. So keeping these in mind, the curriculum has been designed in a manner that it reaches far and wide, and each student has the opportunity, starting from the entry level experience of education, to going right up till leadership and management roles. So the curricula which have been designed for most of these 17 professions, 28 professions, so to say, so far, have ensured that the academic progression is in line with the career progression, and not just the scope of learning, but also employment opportunities have been kept in mind. And as I was mentioning, that international mobility is something that we envisage will become much easier for most of our students. And of course, we are not looking at brain drain, but definitely we are looking at creating allied healthcare professions, not just for India, but for the entire globe, to be able to provide better health and better diagnostics. So I think all the students who are part of our webinar today, I would urge them that look beyond just medical profession, MBBS, dental. There is so much more waiting for you, and the world is your opportunity here. So you have so much. If you have the passion, if you have the drive in you, I think any one of these professions can take you to great heights, both in India as well as across the world. So with that, I will stop. And thank you very much for the opportunity again. Thanks.
Thank you so much, ma'am. Thank you for your perspectives. So now we move on to the question and answer sessions, and we've got a bunch of questions from the audience. So thank you for that. There are some fears about whether allied health and nursing professionals are going to be replaced by AI. I think most of our panelists have touched upon these topics, and no, we are all here to stay, and AI is going to be a tool that would, help us build this ecosystem. Another question is, what are some of the challenges involving policy support and work conditions for nursing staff and allied health professionals? Would one of the speakers, uh, would you want to take over?
Yes, let me answer for this question.
Yes, please. Yeah.
Actually, the need for policy support is important because the nurses today in the workplace, they are facing various challenges. There is no proper nurse-patient ratio is maintained in most of the hospitals due to shortage of nurses, I would say. It is not that they are not willing to recruit. there is shortage of skilled nursing professionals. The moment when they finish, they move abroad. So again and again, we have to train the people, and the new young graduates are there in the place to take care of the patients with the technologically advanced healthcare system. And again, if you say the salary part is not very attractive. If they move, why there is a brain drain happening? Why they are moving abroad? That really, it is a need of the hour to talk about. The salary is very attractive and the perks are very attractive in overseas, whatever is the place they move, including the Gulf countries, starting from Gulf countries to all Western countries. They really wanted to enjoy that work atmosphere, and the proper working hours are there. They are able to maintain the work-life balance. So everywhere we face the challenge of staff shortage, attrition. So every time we have to train new people, and once we train, once they accommodate with the system, they move abroad. So this is happening everywhere. And also there is no proper career incentive and the insurance coverage for the people, emotional support. All those things are, because nursing is the profession, if you see all the time, 24/7, they are with the patients. And they also have a family to run. So everybody has to understand that they have another family to run. So they have to have a proper work-life balance. Without work-life balance, they will end up with emotional instability as well as burnout. So all these points have to be addressed as a policy maker. So in the policy side, such kind of actions have to be taken. Work-life balance and the proper working hours for the nursing staff as well as the allied health staff, maybe. Then the proper nurse-patient ratio has to be maintained. Then safe staffing policy should be there. Mental health support or mental health wellness program and support system should be in place. Proper insurance coverage and the competitive salaries should be there. Then you will not face with all the, because there are a good number of people wanted to stay in India only. They are moving only because of these competitive salaries outside and the work atmosphere and the lifestyle which they get abroad. I would say that these are the areas where the policy support is needed and the professional recognition matters a lot. There are a number of people who stay in the place where the recognition is given, where they feel that they are also being involved in the leadership decisions and so. Thank you.
I'll probably add on to what ma'am just said from the allied health perspective, because for this sector, I would say that up until NCHP came about, there was absolutely no regulator for the allied health profession. So they were being treated as whoever wished to be treated as. So now with NCHP in place and with all the regulations slowly coming in, I think as I mentioned in my talk also, that professional recognition will become one of the most important aspects. So earlier on, even the most skilled professionals in their respective field were kind of looked upon because they did not have the appropriate professional nomenclature. But I think a few professions like physiotherapy definitely enjoyed some privileges, but it was not true for majority of the allied health professions. So I think that's one of the largest policy gaps, which of course NCHP is trying to fill up. And also in terms of skilling and education, I think there was so much of a heterogeneity in the manner of the curriculum being delivered. There was almost minimal integration with clinical exposure. Very few institutions offered hands-on clinical training, but now I think with the new curricula, it has become mandatory for all institutions delivering allied health programs to ensure that there is sufficient integration with the requirements for clinical training. So that's something which nobody can do away with.
Thank you, Doctor. Thank you, ma'am. There are also a few questions regarding male nurses, as in like if one of you can give a gendered perspective on how nursing is disproportionately, there are more women in the profession than men. So would one of you maybe Mary, ma'am?
Yeah, I think Helen ma'am can add on more points because you're the dean of the college. Yes, definitely we need more male nurses because we have a majority of percentage of patients are male. Yeah, I mean, especially in the medical wards. So we do need male nurses to provide care to the patients. But the willingness of coming to nursing profession, I think that's a question among the males to choose nursing or non-nursing profession. I think ma'am can answer more.
Yes, see, surprisingly, there are equal number of men are coming into nursing. Last 5 to 10 years, I could see even 5 to 8 years, every college, if the male seats are available, it is getting filled. So equal number. I would say that even some institutions, 60% are men, only 40% are girls. So that means equal and more than 50% of the men are coming forward to do nursing because nursing is lucrative in nature. And sometimes I feel that they find the job, then only they select the profession. So there are so many NRIs are coming for doing nursing, especially SRM kind of institutions, deemed universities. We don't have problem at all. And they are being best utilized there in the emergency and trauma care area and even the psychiatric area everywhere. They are also equally taking the role. Earlier, actually, the obstetric and gynecology was restricted for the men. But whereas it is not the case, everywhere men are also equally involved. When medical profession is able to accept both gender, nursing also should accept. So everywhere, men are equally treated and equal number of boys as well as girls are studying. Very soon, I think we will not be having shortage in men in nursing at all.
Thank you so much, Doctor. Because of time constraints, I think we should wrap up our session. So, one last question. This is something that we have touched upon previously as well. But, like for students aspiring to work internationally, what are some of the major skills and qualifications that recruiters are looking for?
I will answer this question, madam. See, the international recruiters are primarily looking people beyond their degrees. I think most of the time the students are focusing that they need to have a qualification. I mean, their primary target is getting a degree. But the recruiters, especially both now national and international, are looking beyond. So the professional need to demonstrate strong clinical competency, which I mean, we are being emphasizing from the beginning of this discussion, and a very good hands-on experience. And now the focus is also on the patient safety awareness. In addition to these qualities, they should also have a qualification meeting. It should be from the accredited institution, and they should also have a clinical training or the clinical internship. And certifications like ACLS, BLS adds more value to their qualification. And some of the countries also look for English proficiency. And there are certain, as Ellen Madam has pointed out during her presentation, there are some licensing examination based on the country like DHA, HARD, etc. And in addition to that, the soft skill training is also equally important, especially the stress management, teamwork, handling crisis situation, and emotional intelligence. All these put together, these are the primary requisites for an international recruiter look upon the Indian candidates.
I think with that, we can wrap up our session. Thank you to all our speakers for sharing their time and insights. And thank you so much to our audience also for joining us and engaging with us. Thank you so much.
Thank you very much.
Thank you.
Thank you, madam. Thank you very much. Thank you all.
Thank you all. Thank you. Thank you, Ms. Meenakshi.
Thank you so much, doctors. Thank you so much, Mary ma'am, everyone, for your time. And I think that went well.
Went well, yeah. Okay. Can we take a leave?